Good evening. Welcome to Spine Time. Dr. Singh, please go ahead and get started.
All right. Thank you. Thank you, everyone, for joining us on this new episode of Spine Time. Today, we're going to talk about the best practices after spine surgery. A lot of our discussions lately are prevention, how to prevent back pain, neck pain, how wine can help, mattresses, pillows. But today, we're going to talk about if you had spine surgery, what are the best ways to optimize your recovery? Just a little bit about us. If this is your first time joining us, we are the Weill Cornell Medicine Center for Comprehensive Spine Care, where we really try our hardest to focus on a multidisciplinary, comprehensive approach to your pain, to improve your function, improve your quality of life, including components such as complementary medicine, neurology, physical therapy, surgery, pain management, spine surgery, of course, just to name a few of the key components of our center. And today we are very lucky to have two spine surgeons, Dr. Roger Härtl and Dr. Paul Park. Has anyone seen a happier bunch of neurosurgeons in their life? This is what we do here at Weill Cornell, New York-Presbyterian. So I'm excited to hear their conversation about best practices after spine surgery. Dr. Roger Härtl and Dr. Paul Park, take it away.
Great. Thank you so much for the introduction. And Dr. Härtl and I are very happy to talk about this topic, which is very near and dear to our hearts. And so we just want to introduce the topic of the post-operative period. At this point, you've now had your spine surgery, and now we're working together to really optimize your outcome and also make the post-operative period as tolerable and have a quick recovery as well. And so we're going to talk about two broad categories. The first is surgery in the neck, any sort of cervical procedure, and then low back lumbar surgeries. And in general, there are two different types of surgeries that we'll look at. One is fusion procedures, where we're trying to get two bones to heal together. And then we'll also talk about decompressive procedures, where we're basically just taking away whatever's pushing on the nerve itself without having to do any sort of fusion.
Yeah, I can say a few words. So Dr. Park introduced you to two of the common basic spinal surgeries. Those were primarily the x-rays that he showed were fusion procedures. So we put in implants to fuse two bones together, essentially. And as you can imagine, after surgery, after any type of surgery, but especially after spine surgery, you want to make sure that everything heals up properly. Because if you do things too early, if you put too much pressure on the spine, you can imagine if there's screws and rods in there, you want to make sure that this really has time to heal up and is mechanically stable. So if you go to the next slide, and a lot of this is surgeon dependent. I put in a slide here that I go through with my patients typically after any type of surgery. And Dr. Park may have slightly different guidelines for his patients, but I think for the most part, as surgeons, we all encourage our patients to be careful after any type of spine surgery for at least 6 weeks. I think most surgeons will agree on that. And what does that mean? That means that if you had back surgery, for example, for the first 6 weeks, I really want you to keep your back straight, because we know, and we'll show that later, if you put too much pressure, if you lean forward, sideways, if you bend, cause a lot of pressure. If you had a fusion, there's a concern with the screws, the cage. And if you didn't have a fusion, then there's also a concern, because obviously then the muscles are doing all the work. And the more pressure and the more mechanical strain you put on those, potentially the more pain you can experience, and you pay the price. I have patients who they want to travel like 2 days after surgery, or they walk down, the hallway or the few blocks. And if you do too much too early, you can do it. It's not going to cause permanent damage, but typically you pay a price. So what I tell patients typically, the first 2 weeks, you see that here, walking, sitting, standing, mix it up. Don't do anything for too long. After 2 weeks, a lot of these activities then are broadened. You can go in the pool, elliptical, recumbent bike, so you keep your back straight. And then after 6 weeks, I want you to work with a good physical therapist. So guided physical therapy, yoga, Pilates frequently is a good idea. But again, a lot of this is based on individual preference also. But the main idea is to really take it easy for the first 6 weeks.
Can I ask you a question? On the first picture, you guys showed hardware, metal or titanium inside the spine. Can you talk a little bit about fusion surgery versus just a decompression surgery? What does that actually mean, and how does that impact this timeline that you presented?
Yeah, I can, honestly, for my patients, it almost doesn't make a difference. I show this to almost every patient, because the fact that you have screws in there and rods doesn't really alter the fact that you're just supposed to be careful, right? It is a bit frequently. It is, and Dr. Park, he'll talk about it. He does a lot of bigger surgeries. He's the deformity trained spine surgeon, so for him it may make more of a difference. But in my opinion, the fact whether you have screws or not doesn't really change the fact that you just should be careful. I know, Dr. Park, maybe you want to say a few words.
No, yeah, I agree. Ultimately, the goal is to be as careful as you can be, because regardless you're healing, whether it's your bone or your muscle after a surgery. In terms of why we do one or the other, briefly, I will say that ultimately our goal is to relieve the pressure and take the pressure off of the nerves. And depending on how much pressure we need to take off, sometimes that does necessitate doing a fusion, because if we take away too much bone or ligament without stabilizing those two levels, then it can lead to more symptoms as well. And so ultimately our goal is to take the pressure off the nerves, and the question of whether or not to do a fusion depends on a case-by-case basis.
Recently there's been a lot of interest with MIS, and we've talked about this in the past, minimally invasive surgeries, whether or not it's fusion or not fusion. How has that changed patients' recovery and timeline and kind of functional mobility after surgery?
Yeah, it has had an impact, because a lot of these patients go home the same day, and if they go home the same day, then that is because they usually have less pain. The incisions are smaller, and they can do probably a little bit more early on. But again, I still, even after minimally invasive operation, I always tell patients you got to be careful the first 6 weeks, because you pay a price. It doesn't mean that you can just go on a roller coaster and go backcountry skiing or bungee jumping, because the body just has to heal up. And so MIS is great, but the real reason to really consider MIS, if it's an option, is that just there's lower complications. The infection risk is less, blood loss is less. Yes, recovery can be faster too, but I still tell patients to be careful.
Tell us a little bit about neck surgery versus lower back surgery. What are kind of the differences, again, in bracing and postoperative management?
Sure, yeah. So we can start with the cervical spine procedures in the neck. And the neck is amazing because it has a very wide range of motion. It allows you to look up and down, as well as rotate a lot to the left and the right. And so when we're doing a fusion procedure, even though we're putting in instrumentation, ultimately our goal is to have these two bones heal. And just like any other part of your body, whether it's your arm or your leg or your wrist, when you have a fracture or you want two bones to heal, the best thing to do is to make sure that there's as little movement between them as possible. And so when we do our instrumentation, the reason we use those plates and screws and rods is to hold those two bones together. And often surgeons will recommend using a hard collar as well. And basically this is a belt and suspenders. The hard collar also helps reduce motion through your neck and give those two levels, or however many levels are being fused, a chance to heal and grow bone between those two levels. And again, hard collar use is different in every surgeon's hands, only because everyone's technique and training are a little different. So definitely something you should discuss with your surgeon before the surgery. But it's not uncommon to use a hard collar after a fusion, whether through the front of the neck or the back of the neck. We also recommend against, or I personally tend to recommend against, overhead activity, simply because your neck muscles are still healing, and it can definitely cause some additional pain if you go a little too heavy too fast. And then lastly, sleeping with your head of bed elevated often helps with swelling around the surgical area, especially if you're doing a surgery from the front of the neck. And that can often help in the first few nights after surgery as well.
We live in a very technological society. We're Zooming right now. We have our smartphones and our devices, and a lot of the stuff can cause neck issues and disc herniations. But it seems like patients need to be careful after surgery when going back to these devices. So Dr. Härtl, explain this picture a little bit. What do these numbers mean on this slide?
Yeah, so this is something that I share with patients sometimes. And this basically tells you that, especially the cell phone use nowadays, of course, but really any activity that involves moving your neck and leaning forward or looking downwards puts a lot of stress on the neck muscles. And that can be of relevant in patients who didn't have surgery. They may just have neck pain, or they don't have neck pain yet. But, looking at your cell phone all the time, looking down, can cause strain, muscle strain and pain eventually. But it's also relevant for patients who had any type of neck surgery, right? Because we want the neck muscles to heal up. We want the neck to be neutral. Because you can see here, just by looking at your cell phone, leaning forward at a 60-degree angle, that equals 27 kilograms, which is about 60 pounds or so of pressure on the lower part of your spine, where the muscle and where the neck inserts. And that's a lot of, you're practicing it right now, Dr. Singh. But that's a lot of mechanical support that the neck muscles have to really provide for the head to be maintained in a stable position. And that can cause neck pain, especially just imagine if you had surgery, that you had surgery from the back, surgery from the front. Now those muscles, not only are they in pain, they're inflamed, but now they have to work hard to keep the head up. So that's just a slide, I think, that gives you a nice visual representation of how you should really try to be careful.
And in relation to the lower back, is the same kind of true? How does posture and, a lot of us are sitting a lot throughout the days. How does that affect some of the pressures in the lower back?
Yeah, this is a slide, and I think I showed this before in Spine Time, and I love this. It requires a little bit of, you got to really focus in on it a little bit, but it requires a little bit of understanding exactly what we're looking for here. But the idea is really to show that the pressure in the discs in your lumbar spine varies based on the position of your body. As you can imagine, if there's a lot of compression on the spine, on the disc, that increases the likelihood of potentially patients having back pain, but also a herniated disc. For example, and that's shown by this on this graph here. If you all the way on the left side, when you lie flat, so that's the disc pressure is very low, as you can see here. So there's no pressure in the disc. And by the way, this was done in the 1980s and 90s. They put a little pressure sensors into live patients through the skin. They wouldn't be able to do that today. But the worst case scenario is shown here is where you're slightly leaning forward and you're lifting a suitcase or a box that causes tremendous pressure in the disc. And let's imagine you had a herniated disc, you had a microdiscectomy, and there's a hole still in that disc where we removed the disc herniation. So that really creates a scenario where patients can have what we call a recurrent disc herniation, where disc herniation can just be squeezed out again. And it's not the patient's fault, it's not the surgeon's fault, just the fact that you didn't maintain your posture. So that's how postoperative posture can really be of extreme significance and importance in patients, especially after a recent surgery. And no BLT.
Yeah, what is BLT? Is that a diss on bacon, lettuce, tomato sandwich? What does that actually mean?
Well, that's a great segue into the next portion that really is the three things that all spine surgeons like patients to avoid postoperatively. And the first is bending. As Dr. Härtl showed on the previous slide, ultimately, when you're bending over at the waist, that really increases the pressure that the lower back is seeing. And so whenever I see patients preoperatively, afterwards, I tell them that if there is anything on the floor or if there's anything that they need to get from the ground, the first thing I say is ask for help if you can. But if that's not possible, I will say that bending, squatting if you can, or even going down on one knee while keeping your back aligned is probably the best way to get something off the ground. Because as that study showed, you can really increase the pressure in the discs where the surgery was just performed by bending over at the waist and picking something up as well. And so I will say that this picture is an example of one, how to get to the ground, but something you definitely shouldn't be doing is picking up something like a box or something heavy from the ground. But just wanted to show this as an example of the proper technique to get down to the ground if you need to. So no heavy lifting, and avoid lifting anything off the floor. And even if it's not off the floor, I often tell patients just to not lift anything too heavy, even above about 10 pounds, regardless of position, just to take the strain off your low back.
And the last T?
Yeah, twisting. So similar to your neck, you can rotate quite a bit through your low back as well. And that's when your shoulders and your chest move relatively in a different plane from your pelvis and your hips. And so when you're moving separately like that, you can put a lot of stress across the low back, especially if you've had screws and rods that are placed for instrumentation. Before the bone heals, those screws and rods can see a lot of stress. And so twisting is one of the ways that that instrumentation can see stress. And so one recommendation is to practice log rolling. And often the therapist in the hospital will kind of guide you through this technique. But really being able to first bend up your knees helps encourage moving your shoulders and your hips all together so that you're not putting so much stress through your low back.
You may have said this earlier, but how long do you have these BLT precautions after a spine surgery, whether it's fusion or not fusion?
Yeah, strictly for 6 weeks. Those early weeks are really critical to the back healing. And so I will say during the first 6 weeks, I really encourage patients to be diligent about this. And then after the first 6 weeks, very gradually increasing activity often is probably the safest way to get back to your normal activity.
There's a question that came in through the chat about going back to work after lower back surgery, after lumbar surgery. And a lot of people, just like us, we sit at a desk a fair amount and we have meetings. When is it safe for someone to go back to work? And when they do go back, how long could they sit at a desk before you would recommend them moving around a little bit? Dr. Härtl?
Yeah, it depends on the type of work that you do. Most of us now, not of us necessarily, but most people that we see in the office, a lot of them have desk jobs, or they work from home even. That obviously that lowers really the threshold to send, to allow somebody to go back to work. But then you're facing exactly the problem that patient here, or this listener here has, about how long can you sit on the computer desk. I tell patients 10, 15 minutes and then get up, walk around. Same with sitting, standing. Don't do more than 10 or 15 minutes and try to really mix it up. That's very important. So I tell patients who go back to work, get a standing desk if they haven't had that before already, and mix it up. Sit and then stand up. You can do the same type of work, sitting and standing, as long as you have a standing desk, or if you have the option of using a standing desk. And then it depends on the type of work. If you have a manual work, that's obviously different from, or like a hairdresser where they have to lean forward, for example, or something like that is very different from a desk job.
These exercises shown here are by Hans Kraus. Can you kind of describe what these exercises are, who they are used for, and maybe even who shouldn't do these after surgery?
So I put this in here. It was just an example of things that I encourage patients to do who had lower back surgery. And this is diaphragmatic breathing, which calms them down, but also strengthens the abdominal muscle a little bit. Shoulder shrugs, leg slides, head rotations. Obviously, I wouldn't tell that somebody who had neck surgery, and buttock squeeze. It's just something that you can do even a few days after surgery that's very safe, but gives patients also the impression and the responsibility to start doing something, and makes them feel really good frequently. So those are just examples of simple exercise that are safe, that can be done early after surgery.
Tell us a little bit about this situation. We have a chat message in here about someone who might have had a MIS surgery, maybe a microdiscectomy, did all the things they were supposed to do, no bending heavy, no lifting, and they may have twisted funny at their desk, or bent forward to put their pants on or socks on and developed a recurrent disc herniation. How common is that happening even in patients who follow perfect precautions after surgery?
Yeah, I tell patients there's about a 10-15% chance of having a recurrent disc herniation in the lumbar spine, even if you had a totally successful microdiscectomy. And what you can do to prevent that, that's very difficult because at the end of the day, it's just bad luck. I mean, we tell patients BLT, but in reality, it happens or it doesn't happen. BLT reduces the risk, but it doesn't eliminate the risk. So if it happens, then you treat it as if it was a new disc herniation. So with pain medication first, maybe injections, maybe then some physical therapy. There's a very, very small number of patients who may actually have to go back and need more surgery.
Yeah, there's a question in here about, it's a little specific about pilocytic astrocytoma, which is a type of cancer around the spine, who developed foot drop. Can you guys comment on what is foot drop? And if someone has foot drop, can that recover after surgery or after an intervention?
Sure, yeah. So foot drop is basically where there's weakness in the muscles in the front of the leg. And that is the muscle that basically allows you to bring your toes up off the floor. And the reason that foot drop is especially noticeable is if you are very weak in that muscle, sometimes patients can even trip over their own foot if the foot drop is severe. In terms of foot drop, I will say that even after a successful surgery where the nerve isn't even, you're not even near the nerve that necessarily controls that muscle, sometimes local inflammation just from the surgery, a spine surgery itself in the low back, can cause a foot drop to occur. Not that the nerve is damaged, not that there's anything wrong with the nerve, but often these foot drops that happen after surgery where the nerve is not directly damaged do have a good chance of recovering, but it can take on the scale of weeks to months, not necessarily a few days, but it does take time. Physical therapy will help with that afterwards as well. And then in some cases, and in very rare cases, it is possible that that foot drop is permanent. But again, that's very case by case, depending on the health of that nerve.
What should patients kind of look out for in the post-operative period where they, how often do they follow up with the surgeons after surgery? And what kinds of things should they be looking out for and thinking, you know what, maybe something is going wrong at this point and I need a consultation? What are some of those red flags?
Yeah, one of the first red flags I would say is definitely any sort of increased numbness, tingling, or weakness. I often tell patients that recovery is from a nerve. If you imagine your foot falling asleep for a few minutes, you get pins and needles as nerve wakes up. And similarly, if you've had compression for a long time, that nerve can take a long time to recover. And so some symptoms may feel just like you did right before surgery, and that may occur for a few weeks even after the procedure. But overall, generally, symptoms should continue to improve. If you do have an acute worsening of symptoms, I think that's definitely something to call the office about if you have any noticeable new weakness, numbness, or tingling. And then other things that may occur that aren't necessarily a red flag are things like increased back pain. Regardless of the type of surgery you have to go through your back muscles to get to the spine and the nerves itself. And so it's not uncommon to have new sort of cramping, tightness, and spasm in the low back. And we often prescribe medications to help combat that as well.
Is there a difference between where the wound is in a neck surgery versus a lower back surgery? Different implications? You know, there's a question in there about swelling in the neck after a cervical surgery. What do you kind of tell patients and have them look out for in case something's happening?
I think the swelling is very common, and sometimes you can have delayed swelling even a week or 2 or 3 or 4 weeks after surgery, and sometimes the swelling can get worse. It's not the swelling itself is not necessarily a bad thing, and it always gets better eventually. The concern is, as Dr. Park mentioned, if there's also fevers, redness, drainage of fluid, obviously those are red flags. But the swelling per se is almost normal after any type of surgery. In the neck, it can be a problem if somebody had neck surgery from the front. If the swelling is really bad, it can impede or it can interact with breathing, right, which is a real problem. So that's a little bit more concerning if it gets really bad. But for the most part, swelling is very normal and very expected.
There's a question in here about playing golf after lumbar fusion. You know, we get this question a lot. especially where we work and the interest in golf from a lot of the patients. So Dr. Härtl, tell us a little bit about golfing after either cervical or lumbar fusion. What do you tell patients?
Yeah, so I I don't golf, so I I probably should, so I would have more empathy. But I was taught by a surgeon in the city here, a very successful spine surgeon, and he told me that in the 1980s, when Jane Fonda came up with aerobic, it was aerobics, right? That was that suddenly he became very, very busy because everybody had herniated discs. So I always think about golf like being the same for us, because it keeps us busy, right? Everybody wants to go back. And golf is just really the worst thing you can do for your back, unfortunately. It's great. It's great socially. It is a good exercise for many body parts. But for the back and for the neck, it's just not that great because of the twisting motion. And we see a lot of patients who have problems, either before surgery or if they go back to golfing too early after surgery. So I always caution patients. But I know it's a passion. And what are you going to do? You got to live your life, and everybody's got to enjoy their life. So usually 3 months, I tell patients, try to hold off for 3 months after surgery.
Yeah, Dr. Härtl and I shared a patient who was 90 years old, who had a cervical fusion, and we told him 3 months, and he said, I'm 90. I may not be here in 3 months. And he golfed at 6 weeks. And, so far, knock on wood, that was 6 years ago. Yeah. He's still with us and, still playing golf. I will say the comment about playing golf. Well, Tiger Woods had a lumbar fusion. Tiger Woods actually had a fusion yesterday in his ankle here in the hospital at HSS. So fusion can happen and you can still play, but it's really about changing your mechanics and changing the way you do things. The problem with golf and tennis and even paddleball these days is most people go from doing nothing to playing these sports instead of preparing their muscles and their back and their spine for these activities. So if you're prehabbing and working on your core, and then you're probably going to be successful in playing these sports and hurting yourself less. So, our goal at the Spine Center is to get you back to doing all the things you like to do, whether it's as crazy as bungee jumping or playing golf or whatever, but doing them safely is really our priority. Dr. Park?
Well said.
Yeah, absolutely. I agree. And I think that's a good point to end on, because ultimately we do these surgeries so you can get back to your life and do what you love doing. And there's a safe way to do it. And I think that the best thing to do is talk to your surgeon about it and talk to them about it before the surgery. These aren't things that you should be asking once the surgery is done, but you should be thinking about it before the surgery itself and having that discussion. And ultimately, that's how you have, I think, the best outcomes.
Just in wrapping up and thinking about spine surgery, when you guys see a lot of patients who don't see the non-operative docs first, and many, many times, 80, 90% of the time, you'll tell the patient, you're not ready for surgery. Why don't you go optimize some non-operative treatments? Do some therapy, do some meds, do some injections. Talk to us a little bit about your thought process. Why do you say that? And what are you looking for the patient to have done before considering surgery?
Yeah, in my experience, I find that the human body is an incredible thing. And, there are times that you exacerbate symptoms where you may move a certain way or you may kind of irritate a nerve. But needless to say, a lot of the times the condition is something you've had for a long time. And you just happen to set it off that one time by moving a certain way. And a lot of these conditions can get better on their own. The body helps take care of it. And then these non-operative options really help hold you over and give your body a chance to heal and encourage healing. And so ultimately, I think that the reason to obviously see non-operative management first is that there's a chance you may never need surgery. There are plenty of patients that Dr. Singh takes care of that we never see back, and they can avoid a surgery. And so I always think that that's definitely worth trying before the surgical discussion. Not to say that you may not eventually need surgery, but it's always worth a shot in my opinion.
Can we put a plug in for May 3rd?
Yeah, please tell us what's going on in 2 weeks.
Well, Dr. Carasso, he's a writer and author, psychiatrist, extremely well-spoken, well-published, and we had him on the program a few months ago, and it was probably one of our most successful Spine Time webinars. And there was a lot of demand to have him come back. And so we asked him and he agreed to come back May 3rd. We're going to talk about the pursuit of happiness. Dr. Karasu is a spine patient. He says, I think he admits to that, so I can say that. And a wonderful human being with a lot of insight into the mind and into the mechanism of happiness. So I hope everybody can join us.
Great. Thank you both, Dr. Park, Dr. Härtl, for sharing your expertise on insight on optimizing recovery post-surgery. Thank you all there to the guests who came in and asked their questions. Please join us again in 2 weeks for the pursuit of happiness, which is kind of the motivation here at the Spine Center. We want to keep you functional and happy, whether that's playing golf or tennis or bungee jumping or playing with your kids. Until next time, we've got your back. Take care.
Thanks. Bye-bye, guys. Bye-bye. Thanks.